We've all received vaccines, likely not even considering the training our healthcare professionals received to make sure that the right medicine is delivered in the right dosage to the right part of our body with the least discomfort possible, or at least letting us know how it was going to feel. In reality, our nurse or doctor or pharmacist has received extensive instruction and had ample practice on the procedures that they're undertaking. We're also not likely to have thought about the training they've received when giving our children their vaccines. We're more focused on how the kids will respond to the needle, trying to calm their fears or preparing them for the pain with ibuprofen or the promise of a special treat if they behave. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UTHSC's Teaching and Learning Center. Each month, we interview members of our faculty about their research and its impact on the higher education community. This month, we're talking with one of the authors of a paper titled Evaluation of Pediatric-Focused Immunization Training Offerings at United States Schools and Colleges of Pharmacy, published in the American Journal of Pharmaceutical Education. Together with Ha Fan of the University of Mississippi, Michelle Miller of Roosevelt University, and Jamie Woodyard, Purdue University, UT Health Science Center's Elizabeth Yett wrote this fascinating paper. Dr. Yett is an assistant professor in the College of Pharmacy. Welcome.
Thank you so much, Tom. I'm excited to be here. Thanks for having me.
And we're glad to have you. I'm really interested to talk about your paper. Can you start out by briefly summarizing your paper and talking about why the topic is important to you?
Sure. So I'll start off with just the title of the paper itself is a mouthful, but Evaluation of Pediatric-Focused Immunization Training Offerings at United States Schools and Colleges of Pharmacy. So I'll definitely try and break that down since I know that's a lot of words to describe, not a large paper, but essentially our purpose was to look at the prevalence, the content, and then what barriers might exist to implementing pediatric-focused immunization training within schools and colleges of pharmacy all across the United States. So really our goal was to investigate what pharmacy schools are currently doing, if these topics are being included or if they aren't, and then if they are included or if they aren't, either way, what might some barriers be that they have gone through or that they anticipate, and that's why they haven't included it within their colleges of pharmacy curriculums. This was something I didn't get a lot of training in as a student myself. So this is something that I kind of got thrown into during residency. And that was the experience that many others had as well in speaking with them. And so I think this also I was excited to work on this paper because I'm passionate about making sure students don't have that same experience as me, that they get that chance to become confident and practice ready with vaccinating pediatric patients, and then also just knowing that we have a role in public health, we have a role in immunizing patients in general. And so this helps address all of those things and comes both from a passion of mine, from a public health perspective, and then also from a student perspective of making sure they're ready for whatever they come into in their practice settings in the future.
So the only experience I've ever had, and really the only time I've ever thought about pediatric immunizations is watching my kids get their shots and the preparations that my wife always undertook to prepare them for that. But I never really thought about special preparations that those who are giving the immunizations have to consider. What is different about pediatric immunizations versus immunizations for the rest of us?
Yeah, great question. I think the biggest thing is that it just seems more scary because it's a more unfamiliar patient population to a lot of people, like you just mentioned. So especially for pharmacy students, when they're on rotations or when they're interacting with the public, there are not a ton of times that they're interacting with pediatric patients. It's more our adult patients. And so pharmacists can vaccinate patients as young as 6 months in some states. And so, the parent is holding them or their caregiver, and that child can kick or scream or, be uncomfortable. And we know, or we hope, that an adult wouldn't do that. But we might expect that from a child, or at least adults shouldn't be doing that for sure. And so with that, there's some adjustments to your administration techniques. So maybe you need the caregiver to help hold down their legs so that you can inject them in the thigh, or you need the parent to distract them so that you can not have a needle stick because they moved while you're trying to inject them. And so there's just a lot of different nuances that if you haven't gone through that, you would think it's just the same as injecting an adult patient. But there could also be differences with the sizes of the needles or the width of the needles. And then kind of a whole nother layer on top of that is communicating both with the pediatric patient and with their caregiver. So there's two different, parties involved in this. It's typically not just the child, at least for the younger children. Of course, once they get older and we're guaranteed they're not going to try to hit us, they might not need their parent to hold them down. But there's different techniques, I think, in the language that you use and the way that you communicate with a pediatric patient versus an adult patient. And then, like I mentioned, that additional layer of how to make sure the parent is at ease and that they're okay with the next steps that are going to happen. You can give a lollipop to the kid who just got their immunization, but the parents might be a little more challenging to make sure they're feeling okay when you leave.
Yeah, my mother used to take me out for ice cream if I didn't cry during my shots. And as you're talking, I'm thinking about, some of the reactions my kids have had. I think one time my son passed out when he got a shot. One of my kids had an allergic reaction. And so we didn't know that she was allergic to that. This is the first time she'd ever had that. So I imagine that part of the training is responses to how the children react that might be different than adults. These different biological reactions.
Definitely.
Why is it important for pharmacists to have these skills?
Yeah, and you kind of touched on it by saying, kids might react differently. They might have different experiences that you're unfamiliar with. And so I think any additional exposure that pharmacists can have and future pharmacists can only be a good thing. So most often when pharmacists go into practice, their state will allow them to do pediatric immunizations, some as young as 7, some even younger than that. And so given that there are more states allowing for pharmacists to, kind of meet this need to be able to provide this in the community, I think it's really important that we make sure that our student pharmacists are prepared so that when they go into practice, they have that readiness, they have that ability to adapt to those needs of their patients, and they wouldn't shy away from having the opportunity to immunize a pediatric patient. So that's kind of what our study hit at, is that we're not sure that students are getting kind of that adequate training for pediatrics specifically. They're certainly getting it for adult training, and some of the adult training includes some information about pediatrics, like the immunization schedule and choosing the right size needle. But some of that, I think, just takes a little bit more time and a little bit more attention and focus. I think you'll often hear pediatric pharmacists and providers say that pediatric patients aren't just smaller adults. They respond to things differently. They have their own needs. Their body even processes things completely different than adults. And so I think just having pharmacy students and future pharmacists be aware of those changes in this specific focus area can only be helpful for them, because that enables them to care for a wider variety of patients and feel comfortable in doing so.
You talked about how in 2020, pediatric immunizations dropped significantly. And of course, that was with COVID, and we were all staying home. With the worst of COVID behind us now, those numbers come back up? And if not, why?
I hate to break it to you, Tom, but those numbers have not come back up. So the childhood vaccination rates still have not fully rebounded since the pandemic. So there's actually a study published in March in Pediatrics, the journal itself, and it reviewed vaccine uptake and rates from 2018 all the way through 2023. And they did look at just specific vaccines, so some of our specific childhood vaccines, but that they still remain below pre-pandemic levels. So, for example, one of the vaccines, looking at a pneumococcal, DTaP vaccines, and for rotavirus, about 81% of patients were up to date with these in 2023. But that's compared to about 88% in 2020. So even though that number was not high back in 2020, it's gone down even further since then. So I think some of the reasons why that exists is misinformation still exists. Vaccine hesitancy still exists. I think these things were exacerbated during COVID and then have still kind of lingered for a lot of people. And there are also a lot of changes going on right now to the Centers for Disease Control and Prevention and our Advisory Committee on Immunization Practices. And so I think that just brings about some confusion or questions about what should be done or what is right to be done. And I think all of that contributes to people, like I mentioned, that vaccine hesitancy. So even if a person knows that this might be the right thing to do, it doesn't seem like the best, or they're worried about unknown harms or things that they can't control. And all of that was, like I mentioned, exacerbated during COVID, and I think has lingered. And then there are, new things coming up now with some of those changes to our committee structure and with their recommendations that I think compound what had previously happened during COVID.
You also talk in your paper about how a lot of states do not have laws that allow pharmacists to give immunizations. What is the hesitancy about pharmacists being allowed to immunize children?
It's $1 million question. Why not all states? Why not all pharmacies and pharmacists? I can think of two different reasons. So one of them may be the perception that if we give pharmacists this responsibility, that we're taking it away from someone else. So some other healthcare providers might feel like we're removing something from them. And I think how we view it as we're helping with that responsibility. We're helping to contribute to higher vaccination rates, helping to maybe fill a gap in the area that doesn't exist, that they don't have a primary care physician. So they need to be able to go to the pharmacy because we can meet them where they are there. They don't need a copay. They don't need to schedule an appointment. They can just come there. So I feel like, to me, that means that there are more options available, maybe with better flexible hours for patients and their caregivers that wouldn't be able to exist otherwise. And I think another aspect or another viewpoint might be that if they go to their community pharmacy to receive a vaccine, maybe then they don't go to see their pediatrician or they don't go see their doctor when they need to. But I think as teammates, as healthcare professionals, we should be encouraging everyone to utilize all the resources at their potential. So we'll encourage them to go see their pediatrician for those acute needs they may have to make sure that they're receiving all the appropriate vaccinations. Will help with that, of course. But I think being part of that team is saying, we can provide this additional service. We can be there as an additional point of care for people to help rather than hurt or to take away something from another healthcare provider.
Yeah, I keep on hearing that there's really a shortage of primary care physicians in this country. And you talk about how 90% of the U.S. population lives within 5 miles of a pharmacy. As access to primary care physicians continues to be problematic, are there reasons beside training and state regulations that keep pharmacists from playing a larger role in vaccinations?
Yeah, that's a really interesting question because you would think if it's there that people would take advantage of it, right? So I think part of it might just be patient awareness in general. So, nowadays it seems very common practice for you to go to your community pharmacy in your area and you are able to receive the vaccines that you need, but it wasn't always that way. So that really didn't start until like the early 2000s. And so for patient awareness wise or patient education wise, that reasoning might not connect or it might not click. And so they might not see that as a resource that is available to them. I think also just patient education in general of why vaccines are important to receive, those interactions with the healthcare system. If a person has had a negative interaction, or maybe their family member has, or a close friend, maybe that makes them hesitant to go to a pharmacy because maybe someone else had a negative experience, or maybe they've had to wait for their prescription longer than they liked. And so that kind of, negates the fact that a pharmacist and pharmacy should be there to help, and maybe they see it as more of a burden. I think in addition to that, maybe patients aren't going to see their doctor regularly, or they're not getting prescription meds regularly. And so they don't have kind of those touch points within the healthcare system to see the recommendations of, it's time to get your flu shot, or it's time to make sure you're vaccinated against whatever other vaccine that correlates with disease states you may have. And so I feel like from both that awareness perspective and the education perspective, we obviously can't, force people to receive vaccines. There are clinics maybe that can travel and meet people in different locations, like in churches or community centers or things like that. So that's where our students can really come in and help fill some of those needs and help educate patients. So I think it's just all those healthcare professionals working together to encourage people to receive vaccines and letting them know that this is a resource that's available to them, and hopefully a highly trusted resource.
So you've made a really nice case for why pharmacists should be involved with immunizations. And the problem is that pharmacy schools are not teaching our future pharmacists how to immunize children. Your paper also lists some of the reasons why schools have not incorporated pediatric training into their curriculum. And it was a really interesting list. Two of the top three were the space in the curriculum and the cost to the school. And you talk in your paper about some of the costs involved with doing this. Talk a little bit more about those and how those challenges might be overcome.
I think the problem with most things, right, is not enough time or not enough money. So it was not really surprising that we found those as two of our top barriers. I think most professional and healthcare related schools probably struggle with space in the curriculum. As new disease states are found or new treatments are discovered, we have to take away some of the older things that aren't as relevant, but make space for the things that are maybe more relevant or have become more relevant. And so this is not a new problem. I think for pharmacy schools or really any other health professional school. And so I think then you have to become creative with how you include something like this, a topic like this in the curriculum, knowing that if we're trying to add something, what are we going to take away? Well, is it possible to add it in conjunction with something else to enhance what's already being offered rather than taking a whole topic area away? And so some of the ideas that we mentioned in our paper were maybe including some more specific pediatric training in addition to the adult training that most pharmacy schools have already incorporated. So about 91% of pharmacy schools are using kind of the same adult immunization training program. It's kind of the gold standard, if you will. And like I mentioned, it does have some pediatric topics incorporated, but I think in order to really get to the heart of preparing our students to be practice ready so that they're not having that maybe straight on the job training or they're not feeling uncomfortable or unfamiliar in situations that they weren't exposed to in pharmacy school, that maybe we can incorporate the training specific for pediatrics in addition to that. They're already doing skills checkoffs at this point. They're already kind of in that zone of learning immunization content. And so I think it would make a lot of sense to incorporate that training right alongside with it. I think also we talk about other topics that have to do with immunization, so infectious diseases or pediatric specific critical care, caring for pediatric patients. And so I think that also presents opportunities to loop in some of that content into other areas. So maybe not skills specific, but other didactic topics could include more of a focus on this as well. And I think finally, if none of those work, then at least providing the opportunity in some way, so maybe creating an elective specific to pediatric populations or allowing the student to seek an experiential rotation within this area, I think could be other opportunities if there is no other way that it could be incorporated, I think, more continuously or more thoroughly throughout the curriculum.
Surely there's schools that have incorporated this into their training. How are they doing it? Are they doing the kind of things that you just suggested?
Yeah, there were some schools who let us know that they were utilizing the pediatric immunization training. Some of them use like homegrown trainings that they created either by experiences from the faculty or, kind of keeping in mind the main topics that we kind of spoke about of why this training is important or the skills that are needed. And then there also is an entirely separate pediatric training offered, but the cost of that can be quite significant. And then I think also part of this is the facilitator comfort, which we'll talk about in a bit. But I think even if a school has incorporated this, they probably need someone on board who has had experience in doing this in their practice, which I don't think is a very large number. And so if they're lucky enough to have that person, I think that makes it a lot easier. Or if there's someone advocating for it. Not every school is going to think of that same frame of reference, especially if maybe those state laws don't allow for pharmacists to provide vaccinations to younger patients. That might prevent them from seeing this as an applicable topic, but students can go anywhere to practice. They might not stay in that same state. And so I still think the need is there, regardless of what your state allows for or doesn't allow for, to make sure that your students are prepared.
So you mentioned facilitator comfort, and I can just imagine how nerve-wracking it might be for someone to be asked to give an immunization to a wriggling baby or a crying kid, or somebody that's throwing a tantrum, and how hard that must be. So how do you overcome that? How do you prepare future pharmacists to prepare immunizations for these kids?
Yeah, and that situation you described was something I kind of went through word for word as a resident, and one that I did not feel capable to handle at the time. I really had to kind of work up my courage to feel like I was comfortable and confident enough to vaccinate in a pediatric patient. I'd done plenty of adult immunizations at this point, but that still was a big unknown and something that was very, very scary to be in your face like that. And so I think I would hope not everyone has to go through that same kind of panic moment experience that I did. But I think providing more of like a train the trainer facilitator session. So if we are asking faculty who are unfamiliar to teach students this, they should probably have some sort of experience or practical experience of their own. And so I think maybe offering practicing pharmacists the ability to do this additional training. So maybe hearing from people who have gone through this experience before, people who have done additional training in pediatric immunizations, to hear from those, we're not all experts, but hear from those people who have been through that to maybe mitigate some of those concerns they might have. So training our faculty, if they have not had this experience before, to give them some more of that inside view on what it might be like. And so I think that could help our faculty feel more comfortable in teaching our students. But then on the flip side of that, I think maybe partnering with community pharmacies, local retail pharmacies, or independent pharmacies that are providing these vaccines, like have some of our faculty go shadow them for the day and see what it's like. So I think this also could be a really good opportunity for academic pharmacists, so faculty and pharmacists in the community, to value and appreciate what each other does, but also to make sure that what we're teaching is relevant and applicable to students. We can show them and tell them this was our experience working with pharmacists in the community. So I think there's a lot of ways. Obviously, it would be best to see in person, but if not, maybe we could get them to record a video of what it's like for them on their day-to-day efforts. So we don't expect all faculty to do an additional certificate or an additional training program. I think that's a lot to ask, but maybe giving them those opportunities or offering them, if you want this additional training or if you want this firsthand viewed experience, that we can help provide that for you by partnering with people in our community.
When I was reading this, my first thought was, how do you simulate this? And I had this vision of, when a football team is about to go into play an away team and they're about to go into a hostile environment, that they'll like really blast noise through the loudspeakers at their home stadium and prepare them. I had this vision of, sending these pharmacy students into a room and just having the baby crying and screaming and them trying to get used to having all this noise around them. Because I imagine a lot of these pharmacy students had not been around children in that way. And so screaming kids is something that's very new to them.
Definitely. And I think our students might be used to a patient saying, I'm kind of afraid of needles, so I feel a little hesitant, but that's much different than a child letting you know that they're afraid of that needle by shouting at you or, lashing out. And so I think that is challenging. We don't like to test things on pediatric patients. We don't want to put them in any more harm than they need. But technically, once a student is immunization certified through the program that we use, technically they are able to immunize pediatric patients. But I think they might not feel like they're able to, but technically they do have that ability to. And so I feel like just like giving your very first immunization to an adult patient, that first one is really scary, but once you do enough, it feels like secondhand. I think we might kind of apply that same perspective here. And that's where I think those partnerships could really come in handy with pharmacists who are doing this and who are very comfortable doing this, to maybe help the student through that experience and kind of give them some of that practical advice, but also let them see what it's like. And I love that idea of, instead of like a white noise, calming noise, we're going to give you stressful noises and see how you respond. So I think that's a good viewpoint too.
Frazzled by into that one. Going back to how do we talk to schools about changing their curriculum in order to incorporate this? And I'm wondering, the pharmacies are going to be hiring our students, right? Mm-hmm. And it seems like pharmacies would want students to have these kind of skills when they're coming in. So do pharmacies have a role in, I don't want to say coercing, but forcing or trying to convince schools that they need to think about this before they'll hire their students?
Yeah, that's a really good point. I know most pharmacies now do require or strongly encourage that a person is immunized, certified before they are able to take a job there. So they probably won't ever say specifically pediatric immunized, or what is your comfort with that. But so I think it would be challenging to say you must be able to provide on day one a pediatric immunization. But I do feel like that kind of helps support our role then of saying why it's important for this to be in the curriculum, because this is what community pharmacies are expecting of our students.
Yes.
I think we use that for a lot of things with professional development or interview skills. So things like that, we know that this is what is expected of students after they kind of leave our care. And so I think it makes a lot of sense to correlate this with that of this is the expectation of a student going into the practice environment in a community setting, maybe even a clinic type setting where they provide immunizations. And so it's not going to be unheard of for them to be able to do this. And I think even in addition to that, it could be an additional factor that makes a student stand out, because if another pharmacy school isn't offering this, but we are, maybe that gives them a leg up because they have already had this additional training or additional experiences. And then I think also including the kind of that same collaboration I mentioned earlier, but if they aren't going to provide on-the-job training for new hires, or maybe they will, but they could send their pharmacists then to work with our students when we're teaching about this focus in the curriculum. And so I think it could kind of go both ways, that we can help support community pharmacies by making sure our future pharmacists are well trained in this area, and then they can support us by allowing for their pharmacists who are doing this to collaborate with us and to share their experiences. So I think it could be really mutually beneficial for the community and for pharmacy schools that they kind of embrace that collaborative action.
What changes do you recommend for pharmacy schools based on your study results?
I think kind of considering the barriers that have come up, we understand that does limit what schools can do. We always have to think about money and time, and even, like we mentioned, facilitator comfort in doing this as a topic within colleges and schools of pharmacy, because it might be unfamiliar to many pharmacists. And so I think if we're keeping in mind our role and our part to play as advocates in public health and as supporters of patients receiving appropriate immunizations, I think we could make sure that there is some sort of a focus on pediatric immunization training alongside the regular adult immunization training that most pharmacy schools do. And so I think doing that, in addition to raising awareness of our need, really there is a need for assisting with vaccination rates. As I mentioned, that those rates have continued to go down throughout COVID. And so I think if our faculty are on board with that, then we could pass that along to our students. But then it also goes the other direction of, this is why it's important, because we have this role to play. We have these needs that our patients have, and we can help with them. But we need to make sure that we're doing everything for our students to feel like they can step into that role. And so there's a Pediatric Pharmacy Association, and so they also advocate to be these champions. We can be these champions for pediatric immunizations at our schools and allow that to kind of filter out to the students. And then from a backwards, I guess, navigation perspective, to support why this is needed. So if we're able to get faculty on board to understand this is important for students, and students can see themselves in that role, then that kind of gives us that reasoning why we should be including this, so that we can kind of complete that circle. I think the biggest change is just to at least acknowledge maybe that this is something that should be included, not changing your entire curriculum to do so, but maybe considering some of those few suggestions we mentioned for incorporating this in whatever way is possible, or if not, to allow students this opportunity in some other way by partnering with a community pharmacy, etc., to still give them that opportunity.
So you've got this paper published. What's next steps?
Yeah, so it's very exciting to say that we have also written a commentary addressing the different barriers that we mentioned. So we kind of focused on our top couple of barriers, several of which we spoke about here, and then also solutions to overcome them. So I think we acknowledge that these exist, but we also try to come up with some creative ideas that if schools are saying these are the reasons why, that maybe if you considered it from this point of view, this might help in promoting this as a topic that could be incorporated into the curriculum. I think also we might consider partnering with the National Pharmacy Organization. That is really the mainstay of immunization training, both for adults and pediatrics, to maybe increase that accessibility and availability of their pediatric training program. So maybe that means combining completely the adult and pediatric specific focus training into one to allow more access to that. So the cost is an issue maybe for doing two separate programs. So if it'd be possible to combine them, that could give more leverage to pharmacy schools who can't cover that cost. And then another future direction we might go in is surveying some of the pharmacists who have done separate pediatric training specifically. So not just through on the job or through trial by fire kind of experiences, but if they have done something specific to this, what were the benefits of that? Do they see that as something that should be incorporated into pharmacy school curriculums? So kind of giving that individualized focus on people who have gone through this and what their perspectives were to either hopefully support the need for this in the curriculum and to just give another frame of reference or point of view that maybe my colleagues and I who wrote the paper didn't have.
The other piece, too, is that states need to change their laws, right? And we need more states to provide mechanisms for pharmacists to be able to do those.
Absolutely. And so I think there's a lot of ways for pharmacists. I mean, we're here in the state of Tennessee, but even across the United States to be advocating for this, to be working with their state pharmacy associations to make this a priority maybe of the legislature. So I think also we have our part to play in that. And then, of course, we would always ask for the support of our other healthcare professional colleagues to say, pharmacists can help raise pediatric immunization rates. We can help contribute to the great work that our primary care physician and pediatrician and other pediatric care providers do, that we can help augment their work and just provide another avenue for patients who might not have a primary care physician in their area, but they probably will have a pharmacy. And so if we can kind of partner to make this a priority, it will benefit everyone involved, the patients having more opportunities, our pharmacy students having more experience and getting their comfort level up, and then our pharmacists being able to help fill that vital role in the need of our patients and in public health in general.
So this has been a wonderful conversation. I've really enjoyed learning about pediatric immunizations and in a depth I've never really thought about. And I've really enjoyed listening to what the concerns are and the challenges are for universities and for the states and for the people in your profession. I look forward to reading your next paper. So Dr. Yett, thank you very much for your time.
Absolutely. It was great to share my experiences with you.
And that's this month's episode of Teach Well, Learn Well. I'm Tom Lochner of the Teach Well Learning Center at the University of Tennessee Health Science Center. Until next time.